We are all in this together. The University of Mary is one of 2 locations in the state that has prepared a field hospital. Nikaya Carrero gives us an inside look at the site that Governor Doug Burgum says he hopes he never has to use.
With coronavirus cases on the rise, the state of North Dakota, along with the University of Mary, are prepared in the case things take a turn for the worse.
When we start to get to that point where the cases are climbing, that we're going to be ready to deliver a coordinated healthcare response.
The university's field house that was originally used for indoor workouts is now home to 200 cots that lay side by side with various medical equipment around them.
I thought they were simply going to do a walkthrough, and 3 hours later, I hear that they're laying down plywood.
The U.S. Army Corps of Engineers, the National Guard, and state health officials led the charge in making that quick transformation with wheelchairs, IV bag stands, and dividers. Richter says even more of the university is available if needed.
And so we have residence halls that could be used for quarantine. We also have residence halls ready in case the medical professionals and personnel that may be serving the people that would be here, they could sleep in.
Governor Doug Burgum is set to release a surge plan early next week that will break down what would need to happen in the case there is a sharp increase of positive coronavirus cases.
And preparing for the worst includes having to have these minimal care facilities. I mean, no one's going to be on a ventilator in the University of Mary gymnasium. I mean, we're not going to be able to deliver that kind of care. But if we get to that level, you could be staffed by, volunteers almost.
With 1/3 of the U Mary Fieldhouse being utilized by the 200 cots that are already here, if needed, they could add an additional 500. Reporting for KX News in Bismarck, I'm Nikaya Carrero.
The good news is North Dakota is a long way from needing to use that field hospital. Governor Burgum says the state has the capacity for more than 2,600 hospital beds without any field hospitals, and that less than 1% of the hospital beds in the state are currently being taken up by COVID-19 patients.